Hey, Alpha Nurses, I'm Licensure from alphanurseguide.com. This is 18 practice NCLEX questions. Without the way, let's get started.
A client has been in an automobile accident, and the nurse is assessing the client for a possible pneumothorax. The nurse should assess the client for 1. Sudden sharp chest pain. 2. Wheezing breath sounds over affected side. 3. Hemoptysis. 4. Cyanosis. The correct answer is 1. Pneumothorax signs and symptoms include sudden sharp chest pain, tachypnea, and tachycardia. Other signs and symptoms include diminished or absent breath sounds over the affected lung, anxiety, and restlessness. Breath sounds are diminished or absent over the affected side. Hemoptysis and cyanosis are not typically present with a moderate pneumothorax. The nurse is preparing to assist with the removal of a chest tube. Which of the following is appropriate at the site from which the chest tube is removed? 1. Adhesive strip. 2. Petroleum gauze. 3. 4x4 gauze with antibiotic ointment. 4. No dressing is necessary. The correct answer is 2. Gauze saturated with petroleum is placed over the site to make an airtight seal to prevent air leakage during the healing process. Dressings with antibiotic ointment or adhesives are not used. After thoracotomy, the nurse instructs the client to perform deep breathing exercises. Which of the following is an expected outcome of these exercises? 1. Deep breathing elevates the diaphragm, which enlarges the thorax and increases the lung surface available for gas exchange. 2. Deep breathing increases blood flow to the lungs to allow them to recover from the trauma of surgery. 3. Deep breathing controls the rate of air flow to the remaining lobe so that it will not become hyperinflated. 4. Deep breathing expands the alveoli and increases the lung surface available for ventilation. The correct answer is 4. Deep breathing helps prevent microatelectasis and pneumonitis and also helps force air and fluid out of the pleural space into the chest tubes. More than half of the ventilatory process is accomplished by the rise and fall of the diaphragm. The diaphragm is the major muscle of respiration. Deep breathing causes it to descend, not elevate, thereby increasing the ventilating surface. Deep breathing increases blood flow to the lungs. However, the primary reason for deep breathing is to expand alveoli and prevent atelectasis. The remaining lobe naturally hyperinflates to fill the space created by the resected lobe. This is an expected phenomenon. A 25-year-old client diagnosed with chronic schizophrenia states, "I stopped my medications a week ago. I was just tired of not being able to drink with my friends. Besides, I feel fine without them." Which of the following responses by the nurse is most appropriate? 1. It's important for you to go back on your medicines. 2. I hear how difficult it must be to live with the changes caused by your illness. 3. You will have to talk to your doctor about stopping your medications. 4. Your buddies will understand that you can't drink anymore. The correct answer is 2. By acknowledging the difficulties of living with the illness, the nurse conveys empathy for the client's feelings and opens up the lines of communication. Although it is important for the client to maintain compliance with medication therapy, telling the client that it is important to start taking them again or to talk with the doctor about stopping the medications ignores the underlying feelings of the client's initial statements. Stating that the client's buddies will understand may or may not be true. Additionally, this statement ignores the underlying feelings. The mother of a client with chronic undifferentiated schizophrenia calls the visiting nurse in the outpatient clinic to report that her daughter has not answered the phone in 10 days. She was doing so well for months. "I don't know what's wrong. I'm worried." Which of the following responses by the nurse is most appropriate? 1. Maybe she's just mad at you. Did you have an argument? 2. She may have stopped taking her medications. I'll check on her. 3. Don't worry about this. It happens sometimes. 4. Go over to her apartment and see what's going on. The correct answer is 2. Non-compliance with medications is common in the client with CUS. The nurse has the responsibility to assess this situation. Asking the mother if they've argued or if the client is mad at the mother or telling the mother to go over to the apartment and see what's going on places the blame and responsibility on the mother and therefore is inappropriate. Telling the mother not to worry ignores the seriousness of the client's symptoms, which action by the nurse is likely to increase the anxiety and suspiciousness of a client who is delusional. 1. Informing the client of schedule changes. 2. Whispering with others where the client can observe. 3. Telling the client gently that the nurse does not share the client's view. 4. Inviting the client to join in leisure activities. The correct answer is 2. Whispering and laughing with another person where the client can see or observe a nurse, but not hear the conversation, increases the client's anxiety and suspiciousness. Therefore, this action should be avoided. Informing the client of schedule changes. Telling the client gently that the nurse does not share the client's interpretation of an event, and inviting the client to participate in leisure activities help the client to decrease anxiety and suspiciousness and to focus on actual or realistic events. The nurse and the nursing assistant are caring for clients in a birthing center. Which of the following tasks should the nurse delegate to the nursing assistant? Select all that apply. 1. Removing a Foley catheter from a preeclamptic client. 2. Assisting an active labor client with breathing and relaxation. 3. Ambulating a post-cesarean client to the bathroom. 4. Calculating hourly IV totals for a preterm labor client. 5. Intake and output catheterization for culture and sensitivity. 6. Calling a report of normal findings to the healthcare provider. The correct answers are 2 and 3. The nursing assistant could assist the client with breathing and relaxation and ambulate the post-cesarean client to the bathroom. Removing a Foley catheter would also involve assessment of bladder status and totaling the intake and output and would be a nursing responsibility. Calculating the hourly IV totals for a preterm labor client would involve assessments that require nursing expertise. In and out catheterization, a sterile procedure, and calling reports to healthcare providers, which requires gathering and analysis of data, are responsibilities of the nurse. When preparing a multigravida client who has undergone evacuation of a hydatidiform mole for discharge, the nurse explains the need for follow-up care. The nurse determines that the client understands the instruction when she says that she is at risk for developing which of the following? 1. Ectopic pregnancy. 2. Choriocarcinoma. 3. Multifetal pregnancies. 4. Infertility. The correct answer is 2. A client who has had a hydatidiform mole removed should have regular checkups to rule out the presence of choriocarcinoma, which may complicate the client's clinical picture. The client's human chorionic gonadotropin levels are monitored for 1 year. During this time, she should be advised not to become pregnant because this would be reflected in rising human chorionic gonadotropin levels. Ectopic or multifetal pregnancy is not associated with hydatidiform mole. Women who have molar pregnancies have fertility rates similar to the general population. The nurse is assisting with conscious sedation for a 6-year-old undergoing a bone marrow biopsy. The nurse's most important responsibility during the procedure is to 1. Administer the topical anesthetic. 2. Keep the parents informed. 3. Monitor the client. 4. Record the procedure. The correct answer is 3. During conscious sedation, the client may lose protective reflexes, and adequate respiratory and cardiac function may be impaired. At every procedure, there must be one healthcare professional whose sole responsibility is to monitor the client. Topical agents must be given in advance of the procedure to be effective during the procedure. The nurse would not leave the child to speak with parents. While the procedure will be documented according to the facility's protocols, proper monitoring of the client is the intervention most associated with reducing risks. Which of the following beverages should the nurse plan to give a child with leukemia to relieve nausea? 1. Orange juice. 2. Weak tea. 3. Plain water. 4. A carbonated beverage. The correct answer is 4. Carbonated beverages ordinarily are the best tolerated when a child feels nauseated. Many children find cola drinks especially easy to tolerate, but non-cola beverages are also recommended. Orange juice usually is not tolerated well because of its high acid content. Tea may also be too acidic, and many children do not like tea. Water does not relieve nausea. The primary reason for infusing blood at a rate of 60 milliliters per hour is to help prevent which of the following complications? 1. Emboli formation. 2. Fluid volume overload. 3. Red blood cell hemolysis. 4. Allergic reaction. The correct answer is 2. Too rapid infusion of blood or any intravenous fluid can cause fluid volume overload and related problems such as pulmonary edema. Emboli formation, red blood cell hemolysis, and allergic reaction are not related to rapid infusion. Which of the following should be readily available at the bedside of the client with a chest tube in place? 1. A tracheostomy tray. 2. Another sterile chest tube. 3. A bottle of sterile water. 4. A spirometer. The correct answer is 3. A bottle of sterile water should be readily available and in view when a client has a chest tube, so that the tube can be immediately submersed in the water if the chest tube system becomes disconnected. The chest tube should be reconnected to the water seal system as soon as a sterile functioning system can be reestablished. There is no need for a tracheostomy tray, another chest tube, or a spirometer to be placed at the bedside for emergency use. Which of the following would be a significant intervention to help prevent lung cancer? 1. Encourage cigarette smokers to have yearly chest radiographs. 2. Instruct people about techniques for smoking cessation. 3. Recommend that people have their houses and apartments checked for asbestos leakage. 4. Encourage people to install central air filters in their homes. The correct answer is 2. Epidermoid cancer involving the larger bronchi is almost entirely associated with heavy cigarette smoking. The American and Canadian Cancer Societies report that smoking is responsible for more than 80% of lung cancers in men and women. The prevalence of lung cancer is related to the duration and intensity of the smoking, so nurses can best prevent lung cancer by persuading clients to stop smoking. Chest radiographs aid in detection of lung cancer. They do not prevent it. Exposure to asbestos has been implicated as a risk factor for lung cancer, but cigarette smoking is the major risk factor. There are no data to support the use of home air filters in the prevention of lung cancer. The director of a workshop program tells a nurse that the client with schizophrenia had done well for 6 months until last week when a new person started at the workshop. This new person worked faster than the client did and took his place as leader of the group. Based on this information, which of the following interventions is most appropriate? 1. Make a home visit and tell the client that if he does not return to the workshop, he will lose his place there. 2. Ask the director to assign the client to another work group when he returns to the workshop. 3. Make an appointment to meet the client at the mental health center and ask him about the situation. 4. Arrange for the placement of the client in a skill training program. The correct answer is 3. The most therapeutic action at this time is for the nurse to make an appointment with the client at the mental health center to explore his feelings and behavior. Doing so acknowledges the client's importance and makes him a partner in resolving the problem. The nurse needs to determine what is going on in the situation first, and then plan accordingly. Threatening the client with loss of position, asking for a new assignment for the client, or arranging for the placement of the client in a skill training program is inappropriate and premature. For the client with catatonic behaviors, which of the following should the nurse use to determine that the medication administered as needed has been most effective in the long term? 1. The client can move all extremities occasionally. 2. The client walks with the nurse to the client's room. 3. The client responds to verbal directions to eat. 4. The client initiates simple activities without directions. The correct answer is 4. Although all the actions indicate improvement, the ability to initiate simple activities without directions indicates the most improvement in the catatonic behaviors. Moving all extremities occasionally, walking with the nurse to the client's room, and responding to verbal directions to eat represent single steps toward the client initiating her own actions. The nurse hands a medication cup to a client who is psychotic and exhibiting concrete thinking, and tells the client to take his medicine. The client takes the cup, holds it in hand, and stares at it. Which of the following should the nurse do next? 1. Tell the client to put the medicine in the mouth and swallow it with some water. 2. Instruct the client to sit in the day room and wait for the nurse to assist him. 3. Ask another staff member to stay with the client until the client takes the medication. 4. Say nothing and wait for client to put the medication in the mouth and swallow it. The correct answer is 1. The nurse instructs the client clearly and directly to put the medication in the mouth and then to swallow it with some water. Clear, step-by-step directions assist the client to process what the nurse is saying. Telling the client to sit in the day room and wait. Asking another staff member to stay with the client, or saying nothing is not helpful. A client at 4 weeks postpartum tells a nurse that she can't cope any longer and is overwhelmed by her newborn. The baby has old formula on her clothes and under her neck. The mother does not remember when she last bathed the baby and states she does not want to care for the infant. The nurse should encourage the client and her husband to call their healthcare provider because the mother should be evaluated further for 1. Postpartum blues. 2. Postpartum depression. 3. Poor bonding. 4. Anger management. The correct answer is 2. The client is experiencing and verbalizing signs of postpartum depression, which usually appears at about 4 weeks postpartum, but can occur at any time within the first year after birth. It is more severe and lasts longer than postpartum blues, also called baby blues. Baby blues are the mildest form of depression and are seen in the later part of the first week after birth. Symptoms usually disappear shortly. Depression may last several years and is disabling to the woman. Poor bonding may be seen at any time, but commonly becomes evident as the mother begins interacting with the infant shortly after birth. After dilation and curettage to evacuate a molar pregnancy, assessing the client for signs and symptoms of which of the following will be most important? 1. Urinary tract infection. 2. Hemorrhage. 3. Abdominal distension. 4. Chorioamnionitis. The correct answer is 2. After dilation and curettage to evacuate a molar pregnancy, the nurse should assess the client's vital signs and monitor for signs of hemorrhage, because a surgical procedure may have traumatized the uterine lining, leading to hemorrhage. Urinary tract infections, not common after evacuation of a molar pregnancy, are most commonly related to urinary catheterization. Typically, urinary catheters are not used during evacuation of a molar pregnancy. The client should not experience abdominal distension because the contents of the uterus have been removed. Chorioamnionitis is an inflammation of the amniotic fluid membranes. With complete mole, no embryonic or fetal tissue or membranes are present.
You can get my NCLEX review bundle. Links will be in the description. I'll see you guys in the next video.